I'm Dr. John McDougall, and restless leg syndrome is something I've heard a lot about during my 50 years of medical practice, where I've seen 12,000 patients. And it's a common complaint and not easily solved. There are various medications you can take that doctors will prescribe for restless leg syndrome, and you might want to give those a try. As with most medications, there are going to be adverse effects and positive effects. I personally have not found them very helpful in my patient practice. The other thing is magnesium supplements have been recommended for restless leg syndrome. Again, you might want to give it a try, but you have to understand taking magnesium supplements is associated with an increased risk of heart attacks, death from heart disease, and having heart surgery. In other words, people who take these magnesium supplements, they have some pretty serious adverse effects laying ahead of them, at least as far as their chances go. Well, why would you have restless leg syndrome? A lot of people have it because they can't sleep, and they notice it at night when they try and lie down. They have insomnia, and so what they notice is their legs just kind of jumping around. They may try and solve it with things like alcohol or sleeping pills, and yeah, that's a temporary solution with a great big negative adverse effect for most people. So you don't want to do that. The way I handle restless leg syndrome due to the fact that you have trouble going to sleep is I ask you to not sleep so much. Yeah, people get too much sleep. They think that sleep is beauty rest, and the more they get, the better. And the truth of the matter is you might be able to sleep well and long for one night or two nights. And I'll tell you what well and long means in just a minute. But the third night, you're going to have your battery so stored up, you have insomnia. Now, what's a proper length of time for sleeping? Well, there are some times in life when you need to sleep more, like when you're a little baby, or during pregnancy, or when you're ill, you require more sleep, a lot more. Sometimes little kids require as much as 16, 18 hours sleep a day. But otherwise, an adult does not require that amount of sleep. And there's some very serious adverse effects when you get too much sleep. How much does an adult need? I think one way of looking at it is from studies of longevity. Those people who get between 6 and 7 hours sleep a night live the longest. Fewer than 6 hours, you have an increased risk of dying. More than 7 hours, you have an increased risk of dying. So that's pretty much where it should be. But there are many people who require fewer hours of sleep. The way you figure it out is through sleep hygiene techniques. You pick an amount of time that you think that you ought to be in bed, that you ought to sleep, and maybe err on the side of less than more. So you say you pick 4 hours of sleep at night, you go to bed, and you wake up the next day, and you're just tired all day. You know that's not enough. And then you increase it a little bit more, and you find a point where you're able to go to sleep at that night because you're tired enough, but you're still able to get enough rest. And the other thing, and we'll talk about this some other time, is the association between getting too much sleep and severe emotional, mental depression. That's right, folks. Getting too much sleep causes depression. So I think you'll find the recommendations I gave you. You might also add a little bit of exercise. That may calm down your muscles a little bit. But outside of taking drugs, alcohol, sleeping pills, you're left with sleep hygiene as a way to do it. In other words, don't get too much sleep. And I think that'll help you a lot. Non-toxic, no cost. I'm Dr. John McDougall.